take place. So now I'd like to welcome my next guest into the Navigant Credit Union Broadcast Center. I believe Peter Marino from the Neighborhood Health Plan of Rhode Island is in the building.
How are you?
I'm doing very well. How are you?
I'm doing great.
Well, welcome to the studio. This is where we get the message out and have the conversations about everything going on here. So I appreciate your coming in today to talk with us.
Of course.
Because you had a big announcement. I'm going to play a little closer over here on the red tape. Big announcement this week from Neighborhood about the support of this integrated health initiative and the ability to keep the older population of Rhode Islanders from long-term stays at nursing homes or even moving them out of long-term care facilities. Talk to us a little bit about this success that you've been touting and this approach.
Sure, I think it's a great question. We recently released a press release that talked about the things that we've been doing related to what's called the Integrative Care Initiative. And what it is we're supposed to take care of folks who are both Medicaid and Medicare eligible. Mm-hmm. And so these folks are fairly dynamic. They have a lot of issues that they have to deal with. Mm-hmm. And what we were reporting out this week is that we've been very successful in a very short period of time of helping folks, rather than end up in a nursing home, but actually stay in their community, stay in their home, or an alternative setting rather than going to a nursing home. While our nursing homes are fantastic, the longer you can be in the community, the healthier you're going to be and the happier you're going to be with you and your family.
So how is this integrative approach accomplished? I mean, who do you need? Who are the pieces that help makes this happen?
Oh, that's a great question. This is a complex folks out there. So we have nurse care managers. We have caseworkers, social workers. These folks have a lot of different kinds of needs, both medical and social. Mm-hmm. So we reach out to these members, we meet with them, we spend time with them, and we make sure that we meet their needs. And if we do that well, they tend to live a little bit more independently, and they can stay in their community, and that's really where the success is. It's really kind of a ground game, to use an old military term. It's really a ground game. Yeah. You really have to get in front of these folks, mm-hmm. make sure you understand what their needs are, and really develop a plan to get those things done.
So that's one of the reasons I wanted you in, again, because touting these numbers, actually, we wrote the story. If you want to look on Go Local and you want to Google Neighborhood Health, we do have that up this past week. But, I'm starting local. I think I want to go national and then come back. Trump administration, what you're hearing with the budget, obviously what we saw with the lack of success with the repeal of Obamacare. What are your concerns right now? What are you keeping an eye on down in Washington, D.C.?
Well, as you can imagine, the place has been very interesting. I mean, for the last couple of months, it's been kind of like Wild West.
It is the Wild West.
And a lot has happened, and then at the end of the day, not a lot actually happened. It's kind of a strange scenario. But we've been working with our delegation first, and they've been fantastic. Their vision as to where we need to be and where we are has been really well aligned. It's really about taking care of folks. And Neighborhood has always been here for the last 25 years. We focused on taking care of folks who are at risk, who really don't have a lot of other places to go. So we've really been there for them. And as we watch what's happened down in D.C., we want to make sure that that's top of mind. And of course, we need to make sure that there's improvements made to Obamacare. There are some shortcomings that need to be dealt with. But for the most part, we know that we can deliver a lot of great care to folks in the state of Rhode Island. Neighborhood serves over 200,000 people now.
Wow.
And a good portion of those folks are benefiting from the Affordable Care Act. And that means they're getting better care, they're getting better services, and they're healthier and able to go back to work, they're able to get out in the community, so it benefits Rhode Islanders.
So were you a little trepidatious sort of watching what was going on with that vote down there? They're still talking about trying to come to a consensus. Again, is that something clearly, obviously, keeping tabs on?
Right. They have the legislation that they failed to get the kind of support they were looking for, but it's clear that from a regulatory perspective, that's really what the next step we think is going to happen.
Okay.
I'm not sure you're going to see a piece of legislation in the near term. They'll work it and they'll find something that they can agree to. But more importantly, there's a lot that can be done through the Office of Health and Human Services, and I think that's where you're going to see most of the action. So our attention is turning a little bit to see what we can do to influence that process and see if we can protect the folks here in Rhode Island.
And do you have indications of what they might be looking at from a regulatory perspective that would have an impact on you? Or is it just you just don't know at this point?
There are certain themes about what is and
okay.
The other can define ways to extend more authority. That has pluses and minuses to it. There are certain things that actually the federal government's good about defining, and they're very clear in their definitions, whereas the state can be vague at times. So there's give and take there. Those are probably the two things that you'll see quickly come out through regulatory actions. I think that's where our attention's going to be.
Okay, and as I said, I wanted to start at the federal level and then move locally here because there's a lot going on. And one of the things I did want to ask you, the instability of hospitals in Rhode Island. Let's talk about Care New England and Lifespan both have seen losses. What's your concerns when you look at hospitals in Rhode Island?
Well, Rhode Islanders are actually very lucky. The hospitals here are fantastic. They provide great services. That's really the starting point. They have been struggling, there's no question. For a neighborhood, we're looking to make sure that we can have sustainable services, affordable services to folks, because healthcare is expensive. We want to make sure we can find a place where we can afford to provide that care. We certainly are watching to make sure that as they kind of move into this new world, they're evolving. I think it's kind of early to tell what's going to happen, but there are a number of players. They're large employers, and many of our members actually work in some of those hospitals. So we want to make sure that they're successful.
Mm-hmm.
There's great leadership there, but I think you're going to see a lot of change over the next couple of years. I think Rhode Island is not unique in that fashion, though. I think hospitals across the country have been struggling. The Affordable Care Act has actually been a real great tool to help stabilize some of those financials. If the Affordable Care Act was not in place, those hospitals would actually have a more difficult time right now than you're seeing today.
So where do you see, again, Lifespan or Care New England in the coming year?
Well, in the coming year, it's probably not clear. There's certainly discussions about what the future of Care New England is going to be, whether they find a new partner. I think Lifespan, certain aspects of Lifespan really attribute to a way that might happen.
Mm-hmm.
But there are other players out there. You have Prospect and other players in the hospital market that might step up and say, we can actually do this in a way that allows you to get back to the black, so to speak, in the budget, but also to make sure that they can provide the range of care that they're offering.
Had you heard any rumblings that the Hospital Association of Rhode Island might be looking to court the Senate president?
I think that was a surprise to everybody.
Surprise to everyone.
It was, but she's a very capable woman,
Mm-hmm.
very talented. Clearly, from her 8 years in the Senate, she provided a great leadership and stability there. I think that's important, is stability in the chamber, and I think the Hospital Association will do well with her.
Do you see any difference from your vantage point for the Senate? A lot of folks have mentioned that Senator Ruggiero and the leadership team tended to be in lockstep. Do you see a Senate that looks fairly similar to the one that was there when Private Weed was there?
Well, I think it'll take its own personality over time.
Mm-hmm.
We'll see it as it evolves, but generally speaking, it's a fairly stable chamber. There's not a lot of infighting there. They have great leadership throughout the organization. If you recall, I did actually work there at one point. I was the Senate fiscal advisor, and they're thorough. They spend their time thinking about what they want to do. They don't react, and I think it'll bode well for the new leadership.
How many years were you fiscal advisor for?
I was about 3.5 years.
Okay,
Yes.
you know the inner machinations of the ins and outs in the fiscal office.
I'll tell you what, the budget is probably the most charged issue that the state deals with in any time. It deals with everything from education to healthcare, obviously, to criminal issues. We have to fund an ACI. We have lots of different issues that are dealt with in the budget. So that's kind of always the centerpiece every year.
So I kind of put you on the spot asking you about the hospital landscape, but up at the State House Neighborhood Health Plan, what are the big ticket items this year on sort of your lobbying list of agenda? I mean, if we were to, follow you up there some days, what are you looking to achieve this year?
Okay, well, first and foremost, we want to make sure that the investments that we've made and the state's made, as well as the federal government, because we have a three-way partnership with them to make sure that this ICI, this Integrated Care Initiative, is successful. There's some things in the budget that put that at some risk, so we need to make sure that that's addressed in the budget. That's probably priority number one. Number two is to make sure that folks understand the impact neighborhood is having. We employ about 500 people. We cover over 200,000 people in the state. So making sure they understand the impact. That's 1 in 5 people in Rhode Island.
That is 1 in 5, yes.
So we want to make sure that we show and demonstrate the impact that we're having. The bottom line is that managed care has been a proven model. It saves money and delivers better care, and we want to make sure people understand that when they're deliberating the budget.
And let's tack to something with the UHIP debacle that's going on right now, and they just announced bigger caseload numbers. Do you think the state's going to get out of this anytime soon?
Well, the question there is anytime soon. Something of the technology investment of this magnitude does take some time to get through. And we've been working as a partner with the state to try to work through the issues that we recognize when we're dealing with the data. You have strong leadership there. Anya Wallach is a good secretary. She's going to make sure that she has people focused on it. But it's going to take some time, but they have to have a sense of urgency. These folks need to make sure they're getting covered and getting the care that they need.
So again, we did see this week those numbers spike. I mean, do folks just not have a sense, especially if they're not necessarily in that world? Are we going to continue to see them still remain high as they work to sort of get through the backlog? I know the governor had mentioned, probably a year to try to get out from what we're, but do you see, he said it's not going to happen anytime soon. But again, do the numbers belie, in your opinion, the work that's being done to try to turn the system around?
Well, I think they're trying to do whatever they can to get it to work. But there's significant both technological as well as management challenges. The state's got resource issues, and so they need to make sure they make those investments. But we're trying to support them. I do think that they will get their hands around this, but they need to have a sense of urgency. That's the key, is that there's too many folks that rely on these services for their daily lives to have them out and about not understanding what their role is there. So they need to really get on top of it, and I think they're doing the best they can to get there.
And what else can we expect in 2017 to see from Neighborhood Health Plan? You talked about your legislative agenda and what you're looking to achieve up at the State House, but from sort of your playbook and your board meetings, the 2017 agenda, not just legislatively, what do we expect to see from you guys?
Well, I think probably the most exciting thing happening right now is in the exchange. Right now, we actually reduced our rates by 6%, whereas our competitors actually increased their rates. So I think that's being reflected in people making those choices. When you hear the national discussion about what's happening with the exchange, Rhode Island is actually doing quite well, and I think that's going to continue through 2017. The second thing is that we're working to make sure that people understand the great impact that neighborhood has on Medicaid. We're saving the state money, and we're delivering great care. Folks who have neighborhood, I think, get a real good exposure to great care. They have care managers that interact with them on a regular basis, and they have great teams to rely on.
Okay, fantastic. I guess I wanted to just get a little, again, overview of what's happening now, again, after the release this week about that work with the Integrated Care Initiative and the success that you've had there. Anything else that we missed in this conversation, Pete?
Oh, well, that's like an open question,
yeah,
right?
What else you want to talk about while you're here?
Well, we could talk about baseball or whatever you want to talk about. But I think what's important for me is to get the message out that neighborhood is here for Rhode Islanders. It was created almost 25 years ago. We think about those folks who are at risk, who really need to have someone who's looking out for them and their health care needs. And there's a lot of folks out there who turn to neighborhood to get that work done.
Well, I appreciate your coming in, and if you heard me talking with Dave Allard, do you know there's a trivia component over there?
Yes, I heard that.
You heard there's a trivia component over here. So
the answer is 3. There are 3 balls and a highlight.
No. I'm going to give you pick a card of any card. Okie dokie, and I'll ask you a question. Native Rhode Islander?
No.
Where are you from originally?
Originally from Geneva, New York.
Okay, but how long have you been in Rhode Island for?
22 years, 23 years.
What kind of animal is the Paw Sox mascot?
Oh, that's a bear.
A bear! Yeah. Everyone's keeping all eyes to see what happens if they stay in Pawtucket. Look elsewhere, looking at the apex. You said you wanted to talk baseball.
Oh, we can talk baseball. I think the one thing that we're fortunate with the Paw Sox is that the city has great leadership there. Mayor Gribbian is really on top of this, and they're really paying attention to this, and they want to make it happen. So I think that's really, having that relationship, I think, is going to be important to me. Keep the Paw Sox here.
We'll see what happens with the Paw Sox, and we're in eyesight of the Superman building. That's another thing where folks. Do you see something being done with that in the near future?
Well, it's something that we have to deal with.
Yeah.
We don't want that to be sitting idle for too long. And I think it's really about making sure that the economy is strong enough to people see that as an opportunity. It's going to take investment, though. There's no question.
Yeah.
Something that if you let sit idle for too long could actually become an eyesore for the city. And I think we really need to make some kind of investment there.
Yeah, we've had Stephen Pryor in, and we've discussed it. We had Bill Fisher, who does the PR for the ownership group. Obviously, last time around, they were looking simply at residential, and it wasn't a viable option at that point. But here we are in 2017, a whole new world order. Let's go back a little bit, because I did want to add, we talked a little bit about the impact of the Trump administration and things that you were looking at. But in terms of bigger, broader cuts, of course, folks are, concerned about, the qualification of the sanctuary city status and funding. Healthcare aside, is there a sense that if there's less federal funding coming to the state for other programs, that's going to put a squeeze on the healthcare industry just from that perspective of just the new world order?
Yeah, okay, I think that's actually a great question, because there's a lot of things in the president's budget that are going to impact a lot of aspects that impact health. Everything from cutting Meals on Wheels to heating issues and things of that nature, and that's where neighborhood can actually step in. We actually work with a lot of our community partners, and we provide resources sometimes when we have them available, but taking care of folks also includes taking care of their heat, taking care of their food, We found many times that when we go to visit somebody in their home, we have a number of programs that do that, to deal with their health issue, we first have to deal with making sure they have heat in the home.
Mm-hmm.
We open the refrigerator and they might be a diabetic and there's nothing in the fridge. So there's some basic needs that need to be addressed first. And so the president's budget really does have an adverse impact on some of those services. So neighborhood and others are going to have to step up to make sure that those are done.
I found that with the numbers of guests coming in, it's not necessarily just on their particular area that they're focused on, that bottom line number from the federal government, but as you mentioned, the auxiliary items that impact a person's daily life that then could very well have an impact on your bottom line, additionally into what you might see coming from the federal government.
Absolutely. When people are thinking, they first think about making sure that they can take care of their kids, make sure that they can feed their kids and keep them warm. Then they might start thinking about their health care. So you have to really take care of those things before you can get them engaged to try and address the things that they need to have happen.
And how much of your time do you spend looking at, again, those issues that might not necessarily be in your wheelhouse, but do have an impact? Stuff you talk about with providers, is it more of a conversational basis, or does it have a legislative component as well?
Well, the legislature, the state in general plays a role, but neighborhood really engages with its partners. We spend a great deal of time with that because we know the value of housing, we know the value of food security, and that makes our jobs easier if we can address some of those issues. So we spend a great deal of time dealing with that. It's almost like our secret sauce. If we do that well, actually we provide better health care at a cheaper price.
Yeah, well, that's why I said I had to ask sort of the bigger, broader questions of everything that's going on as we keep tabs on what's going on down in Washington, what's going on in the State House, and of course we expect to hear from you if you have anything coming out that you are promoting or just want to come talk about here in the studio.
Absolutely.
Okay.
Look forward to
Well, I
it.
appreciate it.
Thank
Peter
you very
Marino,
much.
CEO, Neighborhood Health Plan of Rhode Island. Again, I appreciate your coming in today into the Navigant Credit Union Broadcast Center. Always great catching up with the great lineup of folks that we have here for the News and Politics Hour. I do just want to reiterate that there's a couple of updates on Go Local site if you haven't seen already today. Shakeups on Thayer Street. Looks like an institution that's been there for a little while might be being sold to another chain that looks like it's going to possibly come to Thayer Street as the area by Brown University starts to take a little bit of a different look, but as has always happened. And again, did want to let folks know, Go Local did report that coming out of City Hall following the resignation of the former head of the Department of Administration for the city, Robin Muxian, the city solicitor's office has advised the council office, now this is the city council, that because of her exit package, it's almost a gag clause, a non-disparagement sort of caveat that they are advising the council not to speak beyond basic measures in terms of, again, the resignation, forced resignation, or what actually happened to see the ouster of a high-level official. We did hear from City Council President Luis Aponte his reaction to that. You can see that on Go Local. Again, that's up on the site now. So always a lot going on here in the city. We had a very interesting evening with what had happened at the Manchester Street power plant with the gas leak there. Folks are continuing to talk with us. We'll have a piece forthcoming shortly on that as well. As we head into Friday and the sun is finally out, and we'll be back again tomorrow with Molly O'Brien at the 3 o'clock hour for her lifestyle segment with a great array of guests. And I'll be back at 4 o'clock with, as always, Russ Moore and the Hot or Not list. Always an interesting read, usually a little controversial, and always well talked about. So thanks for tuning in here to Go Local at the Navigant Credit Union Broadcast Center. Appreciate your feedback. Don't hesitate to reach out to us and tune back in again tomorrow.